Hello, everybody. Today, I'd like to go over a couple of forms that we do and some processes that we do to help patient compliance. Um, One of the things to understand about physical therapy is it's what's called a grudge purchase. It's not something you really want to do. It's solving a problem, but it takes time, it takes money. It's just like any other purchase. So people need to have time to understand what they're doing and know that what they're doing is good for them and is valuable to them, and that will motivate them to show up for the visits. It'll motivate them to make the time to do the visits, the home exercises, the modifications of lifestyle that are needed, and also find the money to pay copays, deductibles, and all that kind of stuff. I like to compare this to the process of buying a car. So if you can think of the example of, let's say, you and your wife just got married, you have a coupe, you got a two-seater car, and you're enjoying life, and then all of a sudden you're going to be parents, maybe, let's say triplets. Let's make it really exciting. So you go to the car dealership, and they're going to ask you to tell you their story, same as you do in physical therapy. And you're going to tell them the story. Hey, we're married. We're about to have some more kids. We need more seating in our transportation. And they're going to ask you, do you need 5 seats? You need 7 seats? They're going to compare you to the other customers and say, a lot of customers like to have 7 seats because maybe grandma's coming along, maybe when your kids get older and they go to T-ball, their friends will want to come with them. So they've already upsold you on from 5-seater to 7-seater. And then they're going to ask you things like, okay, do you like to take your boat out on the weekends? Do you have a camper? Or are you just going to be ferrying the kids back and forth to T-ball? Are we deciding between a Suburban or a minivan, for example? And you make that decision, and then you'll go test drive. And the test drive is demonstrating value. So you get to see yourself in that situation. You get to imagine you and your family in that particular vehicle. And then they sit down and they talk about price and options, and they give you plenty of time to sit around and think about it. Time's very important when you're making an important decision. And then you ultimately decide, you talk yourself into it. You decide what you want and how much you're willing to pay, and then you make a deal. And our process is very similar. We give you an hour to do an evaluation, which is lots of time for the patient to think about and process what you're talking about and decide that they need to spend the time and sometimes the money to get the outcome that they are asking you for. So we start off with a welcome email. Patient gets a welcome email. It describes where the facility is, what the process of physical therapy is, what clothes you should be wearing, what to expect on your first visit. And what that does is it creates familiarity, which kind of relaxes the patient. If the patient comes in and they have lots of things coming at them, they're only going to absorb so much of it. I've heard a metric that in any situation, a new situation, you only absorb 7% of what you actually hear or see. So this increases the likelihood that they're going to understand what you, the therapist, are saying. So they get familiar, they understand the expectations, they're a little more confident about what they're going to encounter and how the process is going to go. So the next thing they do is they come in and do evaluation. And in evaluation, you ask them your basic 4 questions. Tell us your story. How long have you had this problem? What have you tried? And how's it affecting your life? You also might want to ask things like, what is your main concern? You may want to ask, what do you want to get out of therapy? Because you're asking the patient to tell you what they want, and you're going to sell it back to them. So if the patient says, I want to be able to walk around Walmart without getting one of those little electric cars out because that's embarrassing, there's your goal. Or they may say, I want to be able to climb the stairs to my house. Or they may say, I'm going on vacation to Europe. I want to be able to walk all over. Whatever it is, that's going to be their goal, and that's the goal that you're going to agree on with them. And that demonstrates value in their language, what they want. And we obviously see value in, where's your LEFS score going to be, how much strength do you have, how much range of motion, but people see value in what they want to do and what they want to get out of life. So we talk in those terms when we're doing the plan of care. So when you're talking to the person, you're demonstrating expertise. So you're a doctor of physical therapy. You may want to talk about other patients similar to them that you have treated. That gives social confirmation. You're in the right place. You're doing the right. You may actually want to say that you're in the right place. I treat this all the time. This is something that gets better with physical therapy. You're doing the right thing. And this is very important. Obviously, our patients come in, they've had orthopedic surgery and they're absolutely committed. They're going to do it. They've been told what happens. They've talked to their friends. And you get other people come in with things like back pain that, maybe is a little less predictable. Those people need a little more convincing that they're doing the right thing. And especially people who come in without a prescription. They have not been told by an expert that this is what they need. And so you are the expert and you are going to convince them that this is what they need. So we're demonstrating expertise in this interview process. We're illustrating value. We're not even talking about money. We're not talking about time yet. Ultimately, you're going to talk about a plan. So 3 times a week, 8 weeks, 12 weeks, however long it's going to take. And you're going to set that timeline. So they understand it's not a quick fix. It's not something you can get better 1 time a week for 4 weeks. You got to commit some time. You got to make some effort, and you will get the outcome you want if you do that. If you don't, it's unlikely you're going to get the exact outcome that you want. So you fill this out. You have them sign it. Now, to go back to the example of the car dealership, if you've ever purchased a car, when it comes time to talk about money, you might say, well, I want to spend 25 grand on this car. And they may say, well, we can't do that. We can do 2750 or 27,500 or whatever. And if I can get you that price, would you say yes? And you say, okay, yes, I would. And they say, okay, I'm gonna write this price on a piece of paper and you're going to sign it. And that process is, you're a person of integrity. You don't sign off on things that you don't intend to do for most people. And so if you have gone over this plan of care and you've said, we're going to see you 3 times a week, 8 weeks, and they say, yes, they're agreeing to that. They're committing to the process. They're agreeing with you that that's what they need. If they don't, if you've gone through the whole process and they're like, well, I can only come once a week. What you have failed to do, unfortunately, is you have failed to illustrate the value that they want. Because if you see value, you will talk yourself into it. You'll persuade yourself, I'm going to make the time, I'm going to find the money, I'm going to get this done because that's what I really, really want. If you haven't demonstrated or they don't really believe that either they don't want the result or they don't believe you can give it to them, then they're going to start going back and forth with, how about once a week, twice a week, whatever. And so sometimes you have to go back in the conversation and say, okay, look, I understand that, time, your time is valuable and, your co-pays are high, but, this knee that you just had replaced, it's your knee. In this, you focus your time and resources for 3 months on this knee and you'll be happy for 20 years. If you don't, you'll be pissed off for 20 years because your knee won't bend, you won't be strong, you won't be able to go on vacation, you won't be able to do things you want to do, you'll walk with a limp, which is embarrassing, etc. So sometimes it's important to go back and start at the beginning and have that conversation again and impress upon them how important it is for them to be healthy and able to do the things they want and how that is a source of their happiness and their emotional well-being, and that if you get the ending that's not what you want, then you'll be unhappy. You'll blame yourself. You won't be happy with that. So anyway, I'm kind of repeating myself a lot here. So anyway, so we've established this. You have them signed, and it's very important that you walk them up to the front and you restate this plan of care to the front desk as you bring the patient up for scheduling. Shake their hand, tell them you look forward to working with them. This is very important because very often when you give somebody a piece of paper and say, go to the front desk and schedule, they seem to forget half of what you said. So you have to kind of shepherd them through this process. It's very important to do that. So once they've filled this out, this goes to the front desk, and the front desk will take this as a template, and then we'll create a summary bridge email. I know front desk watching this, we haven't been doing this lately. This is something we used to do in the past. It's very, very effective because they've had this long conversation, they've had this hour experience, they're not going to remember it all. This is a nice little kind of summary of what we talked about, what the plan is, and anything else you want to have in there that just reminds the patient what they're committed to. It reminds them what goals they're working on. It reminds them of the value that we talked about. So if this is all done correctly, you should get good compliance from your patients. They should come in for most of their visits. They should be happy to be here. And what we find is that therapy is very often a very long process. And as I mentioned before, some people are very dedicated. They're very into it. They show up to all their appointments without too much queuing. But sometimes people with more complicated problems, they kind of get in their heads. They're like, I'm still in pain. I'm not where I want to be. And they start to skip visits, and they start to think therapy is not working. And this is what the 30-day plan of care form is for. And this is a little sit down with your patient. You go over these goals should have been filled out over here by the front desk. You go over these exact goals. You say, okay, how are we doing with these goals? Have you been out in your garden doing anything? Have you been able to climb the stairs? Have you been to the store? Find out what they're really doing. And you can either keep the same goals if they still need to work on those things, or you can set new goals, or you can modify the goals. So it's a nice little reminder for the patient. It's a little check-in with the patient and their physical therapist. It's an opportunity for you to encourage them. Very often people come in and they come in on a walker. 30 days later, they're on a cane, and they're like, oh, I feel shit, and therapy's not working, I'm still in pain. And you can point out to them, look, when you came in, you could barely walk with that walker, and now you're like getting around on a cane. And just think about in another month, where will we have you? So it's very important to go over that with your patients, particularly your patients who are getting discouraged, and just kind of check in with everything. Also, you can modify any kind of, if they have problems with particular exercise or activities, or they think things are not doing well for them, you can modify things, and that gives them a sense of control. It's part of that therapeutic alliance. You're working with the patient. It's not one size fits all. You're making a custom program for them, and that is also a demonstration of value. So hopefully this is helpful to you. It's a very easy process. When you look at it in terms of what the patient sees, you imagine the patient experience. This is a very kind of hands-on, individual, customized experience for these patients, which makes them more motivated. It makes them happier with their outcomes, and it helps them do the thing that they want to do to get the outcome that they want. So if you have any questions about this, please call me, email me, grab me when I'm in the clinic. I'm happy to go over it with you, and wish you all the best. Thanks.